Hey, I'm Dr. Cisco Franyutti, and I'm a physician at Hamilton Wound and Hyperbaric Services with Vitruvian Health, and I'm here in Dalton, Georgia. I grew up in Philippi, West Virginia. My dad's a pathologist, and so I've only known, medicine my whole life. After high school, I started college in my hometown at Alderson Broadus College. It was like a private Baptist school. I auditioned and got in at West Virginia University School of Music, and I did a year of percussion there. At the end of that year, I realized that it was fun, but it's not what I wanted to do with my time professionally. So I re-enrolled back in the college and finished out there at Alderson Broadus. That was my undergrad, and then after I graduated, the University of Zagreb had started this medical studies and English program the year before, so I applied, got in, and that was 6 years because in Croatia, you go directly from high school to medical school. It really helped shape me. I mean, I came into residency thinking one thing, kind of the same as medical school. I thought I was going to go be a surgeon. And then once I went there and experienced it and saw the other opportunities, it changed it. So whenever I came here, starting family medicine, like with wound care, that was one of the rotations. It was an opportunity for me to see something else, and it hooked me, and I really liked it. I chose to continue my career here at Hamilton because I like the people here. I felt like I fit into the community. Wound care, it's a lot of hands-on stuff, which I really like. And on top of it, I'm very much into lifestyle medicine. So I like to address people's diet and exercise. And so because there's typically underlying pathologies that cause the wounds or prevent the wounds from healing, I get to address that stuff too. I think that people think that wound care is just somebody comes in and puts some dressing on and a bandage and call it a day and it just gets better. But because the wounds are secondary to a systemic problem usually, for example, type 2 diabetes or type 1 diabetes, you have to address the bigger problems. So you address that, and the wound healing is kind of a result of addressing those things. If a person would have a wound that doesn't seem to be healing, the first step would be to go to your PCP and have them take a look. A wound can be very isolating to somebody. People can't, sometimes it's a mobility issue because of it. It can be painful. And to see somebody come in with a wound that a lot of times they've dealt with for years, and for us to be able to manage that and heal that, and a lot of times fix lifestyle things in the interim, and then they walk out and they are completely healed. You don't have to manage it forever. You see a finish. You're going to be educated. I'm all about collaboration with the patient. I'm not there to dictate. I'm there to work with them and be their coach. What drives me? I like people. And whenever I see somebody that has a problem and maybe they're in pain, and to be able to fix that, to make them happy, to bring them back to living the life that they were living. The thing that I check at the end of the day that helps me sleep is I put a smile on at least one person's face, at least that, didn't bum anybody out.